And I don't know exactly who on the panel might be best able to answer this. Walter's going to jump up maybe and try to anyway. But the question that came was really about the effects of food and food preservatives and food preparation on cancer risk. Now, the truth is it relates to the signal transduction discussion that we've had, and it relates to the molecular biology of cancer. But Walter, maybe you want the microphone for a moment, and you can provide some sage guidance on this topic.
That's a tough question, and it's obviously extremely broad.
But everybody worries about this.
Pardon?
But everybody worries about this.
Right, yes. That what we do to food clearly has big impacts that go beyond often what's produced in the actual food that the farmer harvests. The two really big areas it's not so clear that they relate to breast cancer exactly, but the really big areas we've seen in terms of what we do to food has been the partial hydrogenation of vegetable fats, which lead to trans fats, and clearly substantially increases the risk of cardiovascular disease and diabetes and gallstones. It looks like it's increasing insulin resistance in a very fundamental way. We've looked at that with breast cancer, and we just don't see much relationship. The other aspect is the refining of grains, which is going on just massive scale. We take healthy whole grains and we convert them into refined starch, and those create a big boost in blood sugar. We see that again is related to diabetes and cardiovascular disease. Overall, we don't see much relation with breast cancer, but we do see that if women are a bit overweight and therefore have more insulin resistance, adding on top of that a lot of refined grains, white starch, and sugar does seem to increase breast cancer risk. Those are really the two big picture aspects of processing and preparing our food that we've seen. But there are lots of other things that we do that just haven't been studied very much. The temperature with which we cook some of our meats does create substances that are carcinogenic. That brown crust on roasted meat contains a lot of carcinogens in animals, but so far we haven't seen that at the doses they're consumed in humans that's an issue for human cancer. But again, there's a lot to be learned where we've seen the big picture aspects are very important, but interestingly not as directly important for breast cancer as they are for some other conditions.
So I'm going to ask Lou to make a comment, which I think will be at the molecular level, right?
Well, sort of.
Okay.
I actually spent 6 hours with Sanjay Gupta on Tuesday discussing exactly this topic. There'll be a 60 Minutes program on it that'll air probably around New Year's, about the time you're making your New Year's resolutions. So the comment about insulin resistance, obesity, insulin resistance, and cancer has certainly correlated very strongly with breast cancer, but also endometrial cancers, colorectal cancers, pancreatic, and to some extent prostate. It turns out that PI3K is the mediator of insulin responses. So it is what tells when insulin binds to tissues, the liver, the muscle, the fat, but also if your tumor happens to have insulin receptor on it, then the insulin can tell that tumor to activate PI3K. And in that case, you don't need a mutation in PI3K because the insulin is activating itself. And the consequence is it stimulates glucose uptake and the growth of the tumor. So that's why we think that's the main reason, it may not be the only reason, why there's this correlation between obesity, insulin resistance, and cancer. It's because a subset of cancers, and all breast cancers don't have insulin receptor, but some do. Most endometrial cancers do have insulin receptor because the endometrium has insulin receptor. So I think this is something we do worry about. The one thing to be concerned if you do have insulin resistance, type 2 diabetes, is there are multiple ways to treat it. You can treat it by taking insulin injections, and that, I would say, is a worry because you're raising insulin even further. You can also stimulate insulin release from the islet cells in the pancreas. That also is going to raise insulin. Or you can take what are called insulin sensitizing drugs. So these are drugs like metformin, a generic drug that's very cheap, that actually lowers insulin levels and helps control glucose. So I think most endocrinologists are not really thinking about this. Their goal is just to lower the glucose any way they can. But I think there's definitely retrospective studies that show taking metformin is better than other options for treating type 2 diabetes if you want to try to prevent cancer. So that's, you'll get this whole story on 60 Minutes if you listen.
Well, you know, I just can't help. I can bite my tongue for a while on this, but I can't help adding my own 2 cents, not as a panelist, but maybe as a moderator. The area that I work in actually relates to obesity and breast cancer, and it just shows you that there are multiple pathways to problems. Actually, it's just coincidence, but with Monica's brother-in-law, Andy Dannenberg in New York City, we are looking at obesity as a chronic inflammatory condition. And I won't belabor this except to say that it is that, and that the consequences of that are myriad. This is complementary in a bad way to the issues that have already been highlighted, so that what we eat, it matters in many dimensions, not just exactly what it is, how it's refined and handled, but frankly, how much of it. And this is a modifiable risk factor, and it's something that I think is going to continue to get increased attention for lots of very good reasons.